unfortunately, anybody that hears this, they don't get to hear my spiel about who I am, but you guys can pass that along to them, and that really isn't all that important anyway. Okay, I am sharing my screen. Can one of you just chime in and let me know if you see this document that I call the sample collection verification checklist?
Yep, we got it.
You got it. Okay. All right. So, so this is, let me preface all of this by saying everything that I'm going to show you here, you and your team members are going to have access to everything in PDF format or some other format through the portal that I will set each and every one of you up with. I'm going to set each of you up with your own portal accesses after we're done with this. And in that portal, which I'm going to demonstrate as we move forward here, there's a tab on there called resources, and it's going to be links to download all of these things, all these documents and other things that I'll show you. So my point is, don't worry about doing things like taking screenshots or, taking a ton of notes, because most of what you need is pretty well documented, and is going to be accessible for you after you have your portal access, which I have to get you through this training protocol before I can give you that. So anyway, I always try to start these conversations with a bit of a roadmap of what we're going to talk about. One of the resources that you'll have in your portal is this thing called a sample collection verification checklist. One of these days, I'm going to get around to changing the name of this document because it's not a checklist. It's just kind of a high level, here are the things that we need from you and from your patients with each sample that we receive. And so the top half of the document talks about the ways that we collect patient information. There's one other that I'm going to walk you through as well, but we have this provider portal. It's a portal through which you guys can enter patient information on their behalf. We also have a patient registration portal, something that a patient themselves or him or herself can create their own account and submit their own information. Typically with groups like yours, I don't see a lot of folks utilizing the patient portal. It seems like the agents or the managers or whoever it is that are working with, we call your world, in our parlance, it's we call them community health sites. And so in this community health world, we see most of the time it's the agent or the person that's assisting the patient that's doing the data entry. If you guys are interested, I can set up for each one of you, I can set up a patient portal, a location specific patient registration portal that starts with a QR code that a patient can access with their phone and do it themselves. We'll cover that in a little bit, but I don't have that lined out here on this checklist or this roadmap document. We do have the patient or the provider portal. I'm going to spend most of the time here this afternoon or this morning for you guys going through how to use that. We also have something that I call the if the internet breaks option. If you are somewhere and you just can't get internet access and you can't access the provider portal, hopefully those times are few and far between. We do have a paper requisition form. You'll have access to it again through your provider portal. I would probably, just as a little bit of a fail safe, I would download and print off a copy or two to have just in case you ever run into those situations. I'll give you a brief look at what it looks like. Here it is. It's awful. Like, I'm not going to lie to you. The writing is tiny. We ask for a whole bunch of information, but if it happens, it happens. It's something that, again, you can fill out all the same information that we're going to ask of you in the provider portal, from the patient's personal information to their insurance info, to the tests that we're going to run, to their symptoms and other things. All that stuff is on here. All we would ask is if you or the patient ultimately uses one of these paper forms, excuse me, that it's legible, because we will take this on our end and obviously transcribe the information into our system. And if we can't read it, that's a problem. So hoping that this never comes up, but it's something that I just wanted you to make you aware that we have. So top half of this thing talks about patient information, and then most of the rest of the document we'll get to when I show you again how you collect samples with our particular protocol. It's nothing different than anything you guys have done in the past, but I'm still going to walk you through it. But it's just some do's and don'ts about how to label the samples and making sure that they're packaged correctly and blah, blah, blah. And then at the end, we talk about shipping. I'm not going to go too in depth into shipping today because I'm going to have my logistics coordinator. His name is Andrew. I'm going to have him reach out to each of you at some point after this session so that he can talk to you individually about how you prefer to manage the UPS. We use UPS to ship everything. Um, whether you guys intend to use the pre-printed labels that we've shipped you, whether you intend to just take packages and drop them off at UPS stores, or if you want, if your agents have like permanent sites that they're at, even if it's their homes, where we could send a UPS driver in to pick up their shipments. I don't want to cover that here. It's an individual conversation with each of you. So I'm going to have Andrew from logistics reach out to you to have that talk. Um, and then the bottom just talks about what we do with the samples once we receive them. I'll cover that as we get into the portal here. So let's move to that. So again, I have a feeling most of the samples that you guys submit are going to be registered through this provider portal. Let me go and show you what that looks like. So the URL for it is portal.mobilityhealthlab.com. Each of you, after we're done here, is going to get an email from Mobility Health with a link to your particular portal. It's going to start with that suffix or that prefix, the portal.mobilityhealthlab.com, and then there's going to be a bunch of gobbledygook afterwards that means nothing to anybody, including me. But that's going to be your particular access. You're going to click that link, and it's going to ask you to set up an account where you're just I think most of your information will already be in there. It will, as a matter of fact. You're just going to be asked to set up a password. I would just bookmark this page and have it. So when you log in, so I'm signing in, not logging in. When you log in for the first time or sign in anytime thereafter, you're going to come to a home page that we call our dashboard. And the dashboard is meant to be just that, really just a quick look into what's going on with any activity that's happened at your site recently or your agent site recently. The dashboard is broken up into 2 pages. One shows active orders. An order is active in our world from the minute that it gets registered into the system, which we'll get to in a second, to the minute that it gets completed, where the sample has been tested, the result has been approved by our laboratory director, and a report has been issued. So it will always be it'll be over here as an active order until that completion takes place. Don't worry about all these things that are in my portal. These are from me doing 1,000 of these demos, and I just put in random names, and then we ultimately reject those samples because they're not real. But you'll see anytime a sample has been registered, you'll see the name of the patient, the ID that we assign that sample, and the status of it. The status will change as time goes on. From the minute that it is registered, I think the first status may say pending, which means that it's pending arrival at our lab. So you'll register a sample, or your agent will register a sample, and it'll get shipped to us. During that time, it will say that it's pending. As soon as we receive it, we will scan it into basically into our office, and we will start doing some pre-checking. We will, and I'll get to this in a second, but we're gonna verify that the patient actually has insurance. We don't do any pre-authorizations, but we do verify that the patient has an active insurance policy. As that process is going on, when we scan it into the office, the lab status will change from pending to, I believe, logged. So that if you're wondering what's going on with samples that you've sent in and you see that they're marked as logged, it means that we got them. And so UPS got them here. And sometimes that becomes a concern when we get into the winter months and we have bad weather. You may see some short delays. What I can tell you is we used to use FedEx. We moved to UPS before last winter, and the difference was night and day. UPS does in our experience anyway, just does a monumentally better job of dealing with weather events and other things than FedEx ever did. So we've been really happy with them. Once that pre-check has been done on a sample, we've verified that all the information looks good, the patient does have active insurance, we will physically move that sample into our laboratory under the hood, PPE, all that good stuff, and the sample will get scanned, and that status will change from logged to active. So Again, if you're wondering, or a patient contacts an agent and says, hey, I submitted a sample yesterday, what's going on with it? They can come here to the dashboard. If this Jasmine is their patient and it says active, hey, the lab's got it. It's testing it. They're testing it right now. Shouldn't be too long until you get a result. And then once that test is complete and the result gets approved by our lab director, that sample will move from this active orders table over here to completed orders. And included in the completed orders view on this dashboard is not only links to the patient and their sample, where you can look at the registration, but more importantly, there's a link to view their report. So when we issue results, if a patient, if you or the patient, whoever is doing the registration of the sample, if we have the patient's email address and or their cell phone number, in addition to us pushing the result here into your provider portal, we're going to email and text a link to the patient themselves saying, this is Mobility Health. Your result is ready. Click this link. And they'll click a link in that text or in that email. It will ask the patient for their date of birth as a secondary identifier. This is private health information that we're communicating. So we have to have two forms of quote unquote ID. They'll enter their date of birth and their report will show up. So the patient will get their results directly from us. If we don't have that email address or a cell phone number for them, of course, we don't have a way to communicate it directly to them. So that's why we also push the results here into your portal. So if a patient didn't get their result, wants to know what it was, you can find them quickly on this dashboard page and click view, and their report will pop up. I'm not going to click view here next to Sandra. This is her private health information, but I will show you what a relatively recent report of mine looked like. This is what our results report look like. Pretty basic fare, right? Just the top of the form or the top of the report has the patient's information, name, date of birth, gender, phone number if they have it, the test that we ran, and stuff about when the sample was collected, when we received it, when we reported the result out, and then the individual results for, in this case, we're doing a COVID, flu, and RSV test, the individual results for each of the 4 pathogens we're looking for. If we're doing a COVID-only test, it'll just show COVID here and the yes, no, did we detect it? Everything else that's included in this form, I'm sure you got, or this report you guys have seen before. It's stuff that's required by the CDC that we include, or the FDA, that we include. A description of the test, a brief description of what the results mean. In this kind of a test, there's not a lot of interpretation. You either are positive or you're not. There are other tests that we do where you have to have a more kind of robust explanation of what the result means. That's not the case here. There's some next steps, which are basically, if you're positive, talk to a doctor and stay away from people. That's about it. So that's what a report looks like. Again, that gets pushed directly to the patient and also gets populated here in your portal. You may notice that it says that on the dashboard page, completed orders are left here for 3 days. That's because that we figured that's the most likely time frame in which a patient might come back to you and say, hey, can I get a copy of my result, or what were my results? And again, it's just an easy way to find them. We leave them there for 3 days because we don't want this list to be, we don't want you to be scrolling for hundreds and hundreds of samples. So we leave them there. After 3 days, completed tests or orders will drop off of the dashboard page, but that doesn't mean they're gone. I'm going to skip over the second tab. There are tabs here on the left for the different pages. If you're looking at this portal on a cell phone and you have it in portrait mode, so up and down mode, these menu items will be on the bottom of the screen. Otherwise, they'll be on the left. I'm going to skip over the second one. I told you before that completed orders drop off the dashboard page after 3 days. They will always be on this lab orders tab from now until the end of time. So this will have in your portal every test that you've ever submitted to us. The view on it will show you who the patient is, the date that their sample was registered, and it will have, again, under status, a link or a status of what's going on with the sample, and if the test was completed, under final report, a way to view and download that report that I just showed you. The other thing that's cool about this lab orders tab or page is there's a search box here. So again, you don't have to scroll through hundreds or maybe eventually thousands of tests to find the one you're looking for. You can just put in, I'm going to put in my last name, which is Reuter. It's going to show every sample that I've ever sent or my family has ever sent into our lab since we started this system that we're using back in sometime in like early 2021. Yeah. So you'll always have access to those and can always find them through this search box. Um, so hopefully that makes that easy. Same thing is true. The next menu item is patient with patients. Once the patient has been registered in our system, again, whether it's done through your provider portal or through the patient portal, for those that decide to have patients register themselves, they will be in the system in your portal from now until the end of time. Where this might come into play is if this Sarah Adams, the first name on this list, is one of your patients, and we see that when she registered or when she was registered, she didn't have a primary insurance carrier for whatever reason. Maybe she didn't have her card on her. And so you told her to come back. And when she comes back, instead of having to create an entire new profile for her, you can click here, find her, see her information, hit edit. I'm not going to do it because that's when we get into the private part of things for this person. Hit edit and then go down and enter her insurance information. So again, if she moves, has a new address, gets a new phone number, whatever the case may be, you can always go into this list of patients tab. Same thing, query the patient. If I look for myself, there I am. There's a whole bunch of me's because a lot of these are dummy accounts, but there I am. I will show you this one. If something has changed, you can hit edit and come to the what's called the edit patient screen and make any changes that are necessary. So again, no need to reinvent the wheel anytime that you see a patient for a second time. I'll get to this resources tab at the end here, but I want to go right into what you are going to be using this portal for primarily, which is obviously to enter patients and register their samples. And so that starts with this new order tab, the second one on the list below dashboard. I'm hoping that this is fairly similar. While it might look a little bit different, it's fairly similar to what you guys have done in the past. A new order or a new sample registration is going to start with a barcode. And so if you've seen I know, Holly, I know we've sent you samples or supplies. I'm not sure. I can't remember offhand who else we sent them to, but eventually everybody will have supplies. And with our collection kits, you'll see that each kit is a nasal swab, a tube, of course, that the swab goes into after it's been collected, a biohazard bag that gets packaged into to protect anybody that handles the sample after it's been collected. And then there'll be a strip of little tiny barcode labels. They're not already on the collection tubes. There's strips of them, and so one of those will get peeled off and placed on each collection tube as the sample is being collected. It's a QR code sticker. So if you have scanners, barcode scanners, you can click in this field and scan that sample's little QR code. If you don't, there's a series of letters and numbers that are below each of those barcodes. They always start with MH for Mobility Health, and then I think there's 8 numbers that come after that, whatever those might be. I just hit some dashes. Whatever those numbers are, just type them in. I often get the question, do we have to include the MH? Yes. If the numbers have like 3 leading zeros and then 5 digits after that, put the zeros in there, because this code is exactly what that little QR code that we're going to scan when we receive the samples refers to. So if it doesn't have the leading zeros and we scan that QR code, this record isn't going to come up. If that happens, we can figure it out, but obviously it's easier for everybody if the leading zeros and the MH are included. So if you can just commit that to memory and just try to do that, that would be great. Moving down, this is just a scroll down the list. Hopefully it's a pretty intuitive thing. The client name is going to be each of your folks we're going to assign client site names to. So it will already be selected. You can't change it, leave it alone. The collected by field, as you know, these are meant to be self-collected samples, patients collecting them themselves. They don't need help to do it. If they do, we still classify it as a self-collect. So that's already filled in, leave it alone. The collection date and time, the time and date at which the sample was collected, will be pre-populated with the current date and time. I am pretty sure that even in your time zone, it's going to show Eastern time on there, unless the time that you're collecting the sample or registering the sample, if those two times, the time that the sample is collected and the time at which it's being registered, if those are vastly different, if you collect samples in the morning and take handwritten notes and then enter them into the portal at night, for instance, you can go in here and you can just obviously make a change to the time, make it 10 o'clock instead of 2. If the difference isn't that great, if you're doing it at the same time, leave it alone. If it's only a couple hours difference, just go ahead and leave it alone. We're not that worried about it. But when we get into that 6, 8+ hour time frame, we do want to be as accurate as possible, because we do have a responsibility to report results as soon after they've been collected as possible. And so we just want to be accurate in terms of when that happens. So go ahead and change that if necessary. I think in most cases, you're just going to leave it alone. Under testing, there's a pre-selected button for the COVID, flu, and RSV, what we call 3-in-1 test. I will just give you fair warning. There may be times when the only test that we are running is COVID only. The reason for that is there are times when different suppliers of ours get into different, we go through a ton of inventory for them, and there are times that they can get backed up. And so there may be instances where we pivot and we only are running COVID tests for that day. We will never be in a situation where we're not running COVID. We know that that's the reason that most folks are probably getting tested here, but there may be times where you only see a COVID test and not the 3-in-1 test. Whichever one is selected, you can probably just leave it alone. If we offer the 3-in-1, if we're doing it that day, that week, whatever it is, leave it alone, because it's just more information for you and the patient. But if, again, it's only COVID, it's only COVID. Just leave it checked. Just wanted to let you know that that can happen. Doesn't very often, but I just want full disclosure here. Specimen type, leave that alone. That's a catch-all for the type of swabs we're using. There won't even be another selection, so just leave that alone.
Hey, Scott, can I interrupt for a second?
Please.
So I'm coming to see Jennifer.
Yep.
And I want to get tested for the first time. This is what we need to do for the, if I can call it, the initial intake of the patient?
Correct.
Okay.
Correct. This is one way to do it. There's also a way that the patient can register themselves either at that time or ahead of time. I'll show you that once we get through this. But yes, for the most part, this is what's going to be done on the initial intake of a patient for the first time.
All right. Thank you.
Okay. So we get some basic information about what's, the sample that day, but then we're going to start asking for patient information. So again, to your point, Louis, if it's the first time, you're going to fill in the information. The fields that have asterisks are the ones that are required. And if you try to complete the order without filling out those, you're going to get prompted to fill them out. So it's just first name, last name, address, date of birth, and gender are the only ones that are required. The other ones are nice to haves. Don't worry about race and ethnicity. We used to have to report that with each test. That requirement has gone away. Don't worry about passport number. I don't believe many of your patients are being tested because they're about to travel internationally. But if they are and a negative test is required and they want their passport number to appear on their report, they can fill that. You can fill that field out for them. Phone number and email address, again, nice to have if, again, the patient has them and wants a copy of their report issued to them directly. Again, if they don't, they don't. The reason we have Social Security number in here is I told you earlier that when we receive samples in the lab or in the office, the first thing we will do, or one of the first things, is we will verify that the patient's insurance is active. And so when I get to the insurance piece in a second, I'm sure you guys are used to this. We're going to ask for the name of their insurance company. We're going to ask for their policy number or member ID. We're also going to ask you to upload images of their insurance cards. And that's what we use to verify that the information we're giving is accurate. We can look up based on that whether that patient's, let's say, Medi-Cal card is still active and they haven't been dumped from Medi-Cal between the time they got the card and today. If the patient cannot produce proof that they have insurance, but they're sure that they do. And we understand that if you encounter somebody that maybe is experiencing homelessness or something like that, and they don't carry around their insurance card, but they're confident that they're on the Medi-Cal rolls. If they don't have something that we can use to verify it, we would need their social security number, because we are enrolled in a system where we can take a patient's name, their date of birth, and their social security number, and we can look up both their status of the status of their coverage and get the info we need to file a claim, their member ID or policy number or whatever it might be. So if they have proof of insurance, we don't need their social security number. If they don't, and the intent is to bill their insurance, we have to have a way of proving that they're covered, and we use the social security number to do that. So once that information has been filled out, we do ask, and again, it's a nice to have and not required, for an image of their ID to be uploaded. The only reason that that's really nice to have is, one, if a patient tells you that their name is John Smith and their name is really Jonathan Smith, we're going to make a modification to make that match their official name so that the claim goes through with ease. Or if their name is Robert John Smith, but they go by their middle name, that ID will help us to identify that. It also helps us to verify dates of birth. That's a really important function of any claim, making sure that the patient is who we believe they are. If you come across people that maybe aren't from America originally, they may use the day, month, year format or whatever when they give you your birth date. So again, IDs are nice to have. If you can, I would upload them. When you're using a mobile device, a tablet or a phone, and you hit choose file, it will give you the option to take a picture with your camera so you can upload it directly. You don't have to scan anything or download. You can just take a picture with your device. One thing I'll tell you is, again, you were asking about using this the first time. You do use this the first time, but after the patient is in there once, you don't have to enter their info again. Again, I'll use myself. If I go in this search field and I put my name or start to, there I am, and all my information gets filled out. So again, you only have to do it once. After that, you're good to go. So once we have the patient's information, we need to obviously get their billing information. There's a billing method drop down box here. The one you're going to select every time, I think, is patient insurance, whether it's private commercial insurance, Medicare, or Medi-Cal of the states that you guys are in. There's still some states that we're working on Medicaid. I said Medi-Cal, but Medicaid. There's still some states we're working on Medicaid enrollment with, but we are good with the ones that we're talking about here today. So we're in Medi-Cal, we're in Arizona's, and certainly some others. And I'll update Frank as that changes. Some of the states that you guys are operating in, we haven't done this before, so we have to get enrolled in their Medicaid. The other selections, don't worry about. They don't apply to you guys. I don't think there's going to be too many people that are willing to pay cash who don't have insurance. So if they don't have insurance and they can't pay cash or by credit card, they're not going to be able to do this. The other things, we have some prepaid plans for prepaid patients. They're largely at large employers or employers who are covering the cost of their patients. And the last thing is a direct bill contract that comes with long-term care facilities whose patients are covered by Medicare Part A, where we bill the facility directly instead of the insurance carrier. So don't worry about those. Just select patient insurance. Once you've done that, there's a couple of boxes here. I assume most of your patients are going to have one form of health insurance. Just click this box to open it up. And this is where you'll enter their insurance information. What I would always start with is this search box. So if they are a Medi-Cal patient, let's just use that example. It's not called Medi-Cal technically, it's Medicaid of California. So if you just type in Medicaid, you're going to see a whole bunch of Medicaid plans that are in our database here. And if California is yours, just scroll through the list until you see Medicaid of California and select that. With some of those selections, a bunch of this other stuff, addresses and phone numbers and things, are going to fill out. If it doesn't, don't worry about it. The only fields that we need to have filled out with every requisition are one, the payer name, and the easiest way to get that correct is just to search for it. If you search for one and it's not in the list, don't worry about it. Just come here and type it in and we'll figure it out. Because again, we're going to have copies, we hope, of their insurance cards. But we need to have something filled out in this field for that, because we know that not every patient necessarily is going to have their insurance card on them. But as part of that quick check that we do, we want to see who they say their insurance carrier is. So we need that filled out. And then the other thing that we need filled out is this field, their policy number, their member ID, whatever it might be. For those of you that are, or those of your folks that are in California, in their portal here in this resources tab that I'll get to in a second, one of the things we have is a document that looks at the various types of cards, types of Medi-Cal cards that are out there, and shows you which number from each card we're looking for. It's usually pretty easy to figure out by looking at the card, but just in case, we have a little document there to help them know which number it is that we're asking for. So these are the only two fields, the payer name and the policy number, that we really need to have filled out. The other stuff, again, nice to have, but don't sweat it. What really is important, though, is that, again, we get an image of the front and the back of their insurance card if they have it on them, so that we don't have to go through the Social Security check to verify that they're covered. So again, click this, it'll say, take a picture, take the front, make sure it's in focus and close enough that it can be read. That's going to give us the information that we need around, all this other stuff. The back of the card in most cases is nice to have as well, because that will have the phone number of the office of that carrier that manages that particular policy. So not using Medi-Cal as an example, let's use Kaiser as an example. There are a million Kaiser offices out there. And so for us to know which one to contact if we do have an issue with a claim for this patient, the back of their card is going to have the phone number of the right office for us to contact. So that's why we ask for front and back. I don't know if that's different than what you've done in the past or not, but that's what we ask for. If they have secondary insurance, if they're covered by Medicare and some private policy, go ahead and do the same thing. Put their secondary insurance information in here. If they don't, just leave this box closed and don't worry about it. So that's insurance. And then you're basically just about at the, yeah.
Can I ask a quick question regarding the social number?
Sure.
Okay, so if like you said, they say they have insurance and they provide their social, are we able to submit a test at the same time, or do we need to wait for approval from you guys?
No, go ahead and submit it. We will verify it along with the sample when we receive it. And then if we have an issue, if we can't verify it, or if it turns out they're not covered, they've been dropped from the roll of whatever insurance company is, we will reach out to you and let you know that. And if you're able to get in touch with that patient, you can say, hey, it looks like you've been dropped from Medi-Cal. Do you have another form? But usually with that Social Security number, even if they've been dropped and they've been added somewhere else, we will be able to find out who their new carrier is. And then we'll just update their record. Make sense?
Nice. Okay. In that case, there wouldn't be chargebacks if they weren't covered?
No, because we won't run the test if we can't verify that they're covered. We would just reject the sample. And what we do is, our process is this. We receive a sample and we can't verify that they have insurance for whatever reason. Maybe a Social Security number wasn't included, and we learned through the verification that the card they submitted or the info they submitted was either inaccurate or expired. We will contact you. We always go through you because they don't know who the heck we are. So if we try to call them, they're not going to answer. So we will go through you, and we'll send you an email and say, here is a patient, this patient couldn't verify their insurance. We're going to hold their sample for 72 hours. And so if you can get an answer and an update from the patient in that time period, we'll run the sample. After 72 hours, we're assuming that whether we heard back from you or not, we're assuming that we can't get updated info from the patient, or in fact, they truly don't have coverage, and then we'll reject that sample. So we don't get into the point that's how we avoid chargebacks, is we don't run samples unless we know that we have a good chance of having a successful claim. Make sense?
Okay, great. Yep.
Yeah,
Absolutely.
we want to pay you and not have to ask you for it back. That's the bottom line.
Nice.
Um,
Thank you.
Yeah. So once we've got insurance info in there, um, obviously each test has to be ordered by a healthcare provider. We have an internal medical director. Her name is Bernadette, who is licensed in all of your states. She will be the selection here, so you'll select her as the provider. And then as you build your teams, and you guys can make this decision collectively or individually, it doesn't matter. But Holly, if you have 5 members of your team and you want them all to live, quote unquote, in the same portal where everybody has, uses the same access or email to access it, that's perfectly fine. The way that we can differentiate between who did what, or you can credit who did what, who collected which samples, is we have this drop-down list here called requisitioner. This is a recent addition that we've made for exactly these situations. We can add a list of any of your agents that are at that site or in that portal, and they can select themselves as the requisitioner, as the person that's registering that sample. And then when we issue reports for payment to Frank or Lou or whoever, those reports will show by requisitioner who was responsible for each sample, and ultimately, again, who should be paid for that. If you'd rather each person have their own portal, which means it's their own email address that they're using to access it, that's perfectly fine as well. It'll just show their name only as the requisitioner. So we can figure that out as we go along. To date, I think I've created individual locations for everybody, Frank, that you gave me a list for, which means that I would set them up with their own access. But as time goes on, if you guys want to change that or consolidate that, or as new people come on board, if you just want to put them under your portal and add them as a requisitioner, I'm indifferent. We're indifferent. But we want you guys to have a way, no matter what, to be able to track who's doing what. So they would select that person.
Quick question on that.
Yep.
So the requisitioner, that's something that the agent will fill out on their end, or as a manager, we have to put that in?
No, the agent will do it. Whoever is registering the sample here will do that. So if I'm the agent, I'm going to select my own name from the drop-down list. You guys don't have to do anything as managers when it comes to this.
All the agents' names will be in there?
If a login to the portal is going to be used by more than one person, let's say we use your email address as a login to a portal, and you just want your entire team to use, whether it's your email address or some email address, and that's your team's that's a login to your team's portal. If you want to do that, then we can add all of those team members as requisitioners to that portal account. And then as each of them register samples, they can select themselves as the requisitioner. And then once that order has been created, nobody else can go back in there and change that selection. So if I registered it and Andrew went to the dashboard and saw that sample and said, I'm going to be sneaky and I'm going to lay claim to that thing, he won't be able to do it. Once the requisitioner is selected and the order has been saved, it's locked in. So that's one method to do it. The other method would be to give each of your team members, based on their email addresses, their own portal accounts. Totally up to you how you guys decide to do it.
Okay, but if we gave them their own email accounts, would we as a manager be able to see their activity?
Yes. We're going to set you up. Each of you will be set up once I know who that's, once I kind of understand the hierarchy, we're going to set each of you up with access to your own account, your own portal, if you're going to use one, and the portals of each of your teammates. So again, we're trying to be accommodating to however you guys like to manage your businesses.
Okay. Thank you.
Okay, so we can talk about that individually when, the next time we speak. Okay, so whether it's from a list or if it's a site where they're the only person using the portal, they'll select their name from this list. And then I think you guys probably know this. Insurance, the ICD-10 codes is insurance speak for symptoms. Rather than having a laundry list of check boxes for people to look to indicate symptoms or the reasons why people are being tested, we just have a little search box here that's pretty intuitive. So if you have a patient that has a cough, type in cough, and that ICD-10 code will come up. And if you arrow over it and click it, a little blue bubble will appear with that ICD-10 code, because that's ultimately what gets reported with the insurance claim. If they've been exposed, they think. So they've potential exposure. Start typing in exposure, and we have two. One is exposure to somebody that has COVID. Another is they've been around somebody that's sick with something else. Pick whichever one applies. I meant to pick, this is a hypothetical, if I meant to pick COVID, the COVID code instead of the other communicable diseases code, which is what this one is, I can remove this by arrowing over it, clicking it and making it go away, and then going back in, typing in exposure and picking the one I actually wanted. Go ahead and select, or look up and select as many of these blue bubbles as apply. If you have some hypochondriac that's got that's sneezing and has headaches and cough and thinks they've been exposed and whatever, has a broken arm, whatever, go ahead and type those things in, put as many as apply. The bottom line is, though, we have to have at least one blue bubble in order to be able to process correctly. If you don't have any, for instance, and I try to create this order now, I'm going to get an error, and it's going to tell me what the possible errors might be. More often than not, it's when insurance is selected. Again, we've selected patient insurance, which you are going to do as the billing method. You need to provide at least one ICD-10 code. And then again, I told you before, we need the patient payer name, which is their insurance company, and their patient insurance ID, which is their member ID or policy number. Those fields need to be filled out. So that's the source of the error. If I let's say we got a fever, if I have a fever, and I have that blue button and I click this order, now the order will go through because I also up above have my payer name and my policy number filled out. By the same token, if you forget to fill out the requisitioner field, and this is blank, and you go to create the order, it's going to prompt you to make sure that you fill that out. Same thing for any of the other required fields like provider, like patient first name, etc. So if you get errors, those are going to be the most common reasons why you didn't fill something out, or again, we didn't have the basic patient information, the name of their carrier, their policy number, and their ICD-10 or symptoms recorded on here. We don't do the check for the insurance cards. Again, if at all possible, we want to get images of them. But again, we do understand, especially with some of the patients that you guys will likely be working with, that they may not have those cards on them. If they do, we want them. We want images of them. And if the first time you test them, they don't, and you think they'll be coming back, please ask them, even though we're going to look them up again with their social security number if we don't have their card on file, ask them next time to bring it with them if they have it, just so we can update their file and make sure that we don't have to do the social security check every single time. Make sense?
Definitely.
Okay, so that's basically it. You hit create order and you're done. The order will then show up immediately on your dashboard page as an active order, and we'll be waiting to receive it on our end. Any questions around that?
No, that's really a simple process for sure compared to some of the other ones we've used.
Oh, well, I'm glad to hear it, because sometimes I keep talking and talking and I feel like I'm making it more difficult. So that's actually really good. That's
you
good
are
to
an
hear.
awesome trainer.
Yes,
awesome.
yes. And then,
Thank
as you say, if it's a repeat customer, all you have to do is type in their name, and
Yep, just query
all that information is already in there.
Yep, you got it. Yep, and I think you can do it here too. Like if Sarah, let's use me. I don't know the answer to this, so let's find out together. If you went to list of patients because Scott Reuter came up to you and said, I need to get tested again, and you find Scott, oh, dang it. I thought there would be something here where I could start a new order here for him as well, but it doesn't look like it. I'm going to talk to IT about that, because that's kind of another way to do it. But anyway, yeah, like you said, start at new order, put their barcode in, come down here, query them, and all their info will pull up and you're good to go. Okay, so that's how to enter an order, how to register a sample. Any more questions around that? Okay, let me show you the last thing in the provider portal, and then we're going to move on. There's this resources tab that I alluded to earlier. If you click that, yours will look a little bit, the names of the files will look a little bit different for you. But again, anything that I'm showing you here and some other stuff as well will be linked here as PDFs in your and your agent's portal. Whoever has a portal account is going to have this list of files. Some of the ones that will be in there is this requisition form. That's the paper form that I was showing you about before, the if the internet breaks. Click that, download it, print a couple copies, stick them in the car. The nasal swab instructions that I'm about to go over after we get through this, that's on there so that they can have printed copies of those for patients to refer to as they collect their samples. We've got some, you'll see in the packages that you receive with your collection kits, there's some marketing materials, some flyers. A lot of people, if they're at a facility or if they're at a table or a tent or something like that, they'll put these out. We send you guys laminated copies of these that are a little sturdier, but if anybody ever needs to print other ones, we want them to have resources or the access to them here. So again, there's other stuff as well I'm not going to go into, but really anything you ever wanted to know but were afraid to ask about this program, in the resources tab, there's something you can read to either display or learn. The last thing I'll mention is in my version of the portal here, it's under this shared files, but in yours, it will be up here in these what we call regular files, is this provider portal instruction sheet. So I just spent whatever, half an hour, 20 minutes walking you through how to use the provider portal. Let me show you that document that I just showed you is this. It's a 9-pager. It has screenshots. It's got just a step-by-step, page-by-page of everything that we just talked about, from the dashboard page and how to interpret it to how to enter a new order, starting with the specimen barcode number. It's got call outs to things that might cause errors, little do's and don'ts, things like that, required fields versus not required fields, literally everything that we just talked about. So again, something that I would definitely have everybody review once, even if they just look at it once to review it. Chances are this system is intuitive enough that once they do one requisition, they're never going to need this again. But if they ever come across an error or something they can't figure out, you guys are all going to have my contact info, and I want you and your teams to call me or text me or send me a smoke signal if you ever have an issue. But more likely than not, if you do encounter an issue, it's going to be covered in this document and what to do about it. So we took a lot of time to put this one together, and would appreciate it if folks can at least have a look at it and understand what the provider portal is all about. Okay. So that's it for that. I'm gonna briefly cover the patient portal because I want to talk to each of you or your agents individually before we paint with a broad brush and assign a patient portal access or QR code to everybody if they're not going to need it. But for those that do decide that they want to allow their patients to register themselves into our system, it's into the same database. It's just a different portal through which that happens. We have a patient-facing portal that starts with scanning a QR code. So if you have that patient that walks up and they're tech savvy and they've got a smartphone and you think they can do this themselves, have this thing printed out. That QR code will link to a URL that will be specific to each site. It'll have an embedded access code in there that will be that we will assign to your site, your individual site. Patient scans that QR code. Here's some instructions around what they do to work their way through the system or through the portal or the registration, I should say. Pretty simple to do. I can give you a quick demo here if you bear with me. This account I have for the patient portal looks really similar to the provider portal. has a dashboard page. The only difference is they're not going to have a table of active and completed orders. They're just going to have these tiles that show samples that they have registered and submitted, again, since the beginning of time. Just a quick look at what's going on. So it's blank the first time they go in here, but as soon as they register a sample, it's going to show up as one of these tiles, and it's going to say what test is being run, when they registered it, and again, what the status is of the sample. So if they do happen to come back into their patient portal, they'll see the sample move from pending to log to active to complete. They will, again, on a phone in portrait mode, these menu items will be along the bottom, not along the side. But once they come in here for the first time, create their account, they'll be on the dashboard page, which will be blank. They just need to work their way through the menu items. Starts with their information, just like we did before. Have them type in all of their required information. Again, they can upload an image of their ID, which we love. Same deal on their insurance. Have them fill in the name of their payer, have them fill in their policy number, and have them upload an image of the front and back of their insurance card. And they can do that for if they have 2 forms of insurance, right? Save their changes. Now we have their information. And then they go to this order test tab, which is where they take over with what's going on with them today. So they'll fill out the MyInfo, the MyInfo page once. And then if they come back to test again and they want to use their patient portal to do so, they can skip over the MyInfo and they can just go to order test. You give them a collection kit. They put in their barcode number. All this stuff will be filled in already. Their client site name, which is your site, again, collected by themselves. The date and time auto-populates. And then this is unique. It will ask them if the test that they are registering is for them or somebody else, one of their dependents. So if mom comes by with her daughter, mom can fill in her information because she's the one that is probably has the insurance policy. So that's what we will be reporting with the insurance claims. As far as the insurance information goes, that's going to be associated with mom. But if she comes in with her daughter, mom can take her kit that you guys hand her. She can put in her barcode number from that kit. She can say that this test is for me. She can scroll down here. She can tell us which test it is that she's looking to have done. Let's say it's a COVID test. She'll answer some questions. This is a little bit different. We don't ask them to do ICD-10 codes. We ask patients just to check boxes. Have you been in close contact with anybody in the last 14 days? Yes or no? And whatever the answer to that is, do you have any symptoms or do you have no symptoms? I have a cough and I haven't been exposed, or haven't been around anybody. Hit create order, and that sample will be registered and it will show up here on her dashboard. She then can go back to the order test page, take her daughter's barcode from her kit, enter that, say that this test, as opposed to being for me, is for a dependent, and I can put in Susie's name here, right, and her date of birth. Wow, Scott, what are you doing? And I can tell you her gender because that's what one of the things we're required to report. And then I can say for her, I want a COVID test, and she was around somebody, but she doesn't have symptoms, and register her test. So we don't, for kids and dependents, we don't have to have an entirely new profile for them. If they're covered by mom's insurance or they're on dad's Medi-Cal policy, they can be registered right along with mom and dad as a different sample and a dependent. Does that make sense?
To me, it does, but I'm a little confused because that's something we've never done.
Yeah, I figured.
We've always had to have the child's information as the patient.
Yep.
And then add the ID of the parent and let them know if it's self, child, spouse, or whatever.
And that can be done this way as well. But the difference, the reason that we do it this way in the patient portal, in the provider portal, you're going to do what you just said. You're going to enter the child as a patient, and you're going to put the parent's insurance information along with it. But in the patient portal, again, this is a patient being able to do it itself. Right. in order to have a patient portal account, you have to have an email address. I don't know a lot of 4-year-olds that have email addresses. And so we don't want them to have to come up, like if a family only has one email address, we don't want them to have to create a new Gmail account just to be able to register their child's sample. So that's why we made this, any dependents fall under the parent's parent account, if that makes sense.
Yeah.
This only applies to the patient portal.
Yeah, personally, I'm probably going to stay away from that.
Yep.
But,
Yeah.
Up to all our agents.
Yeah, and that's why I started with the patient portal, and I kind of prefaced it by saying I have a hunch that most folks are just going to want to stick with that provider portal that we went over before. It's probably what you're most familiar with. But again, if there are folks that want to let their patients do it, it's just an option that we have, that we can set up a patient portal link and QR code for them, and they can have folks register their own samples. But if that's what happens, if somebody decides that they do want their patients to register themselves, as soon as they create an order, in addition to that sample showing up here in the patient's dashboard, it's also going to show up in that site's provider portal as an active order. And so if a patient registers their own sample, what I would encourage the agent to do is to make sure they take a quick look in their portal and make sure that that sample showed up before they lose, contact with the patient. Because if the patient makes an error and they think that they did everything right, but for whatever reason it didn't go through, and they walk away and it hasn't showed up here in your provider portal, then, we'll figure it out, but we've kind of lost that opportunity to make any of those changes. Okay. One last thing I should mention about the patient portal. Again, I don't want to spend a ton of time on this. I will with the folks that decide they want to have this as an option. If I'm gonna put in a dummy sample here. And so I put in a barcode number, and I'm going to do this test. And again, in order to be eligible for health insurance coverage, the patient has to have either symptoms or suspected exposure to somebody who's sick. Let's just keep it simple with COVID here. All right. If a patient is using this and they say, nope, I haven't been around anybody that's sick and I don't have any symptoms, and they try to register this test, it's going to tell them they're not insurance eligible, and it's going to prompt them for payment. So if there are folks out there that don't have insurance and they're really that interested in getting tested and they want to pay for it, they can. We charge $99 for the test. They can click pay for testing here and put their credit card info. I don't see that happening, but that's what would cause this error or this payment required to come up, is if they didn't mark any symptoms or exposure, or again, going back to that last page I showed you with their My Info, if they didn't fill out the fields for the insurance company name and their policy number. So if they made a mistake, they can hit cancel and say, oh yeah, you know what, I actually do have a sore throat, hit create order, and it'll go through. Okay. All right. So I didn't want to spend too terribly much time on that, because again, I have a feeling that that's not going to be a popular option for your sites. But again, I'll cover that with folks that need it. So I'm back on this checklist, this initial document that we talked about. We talked about, how we collect information. The rest of it, again, talks mainly about collecting samples. You guys have done this 1,000 times. This is going to be falling off a log, but let me make sure that we're covering our bases here. One of the other documents that you get printed copies of with your collection kits, but you also have access to download through that resources tab in your provider portal, is this document we call nasal swab instructions. I always like to see agents have this out so that patients can refer to it if they need to. Not going to cover this top part, right? That take the swab out of the package. Duh. This is a self-collect test. It's a nasal swab. It's not a brain swab, but they do need to get us a good representative sample. And the way we recommend that they do that is they put the swab in as far as it's comfortable. It should not be uncomfortable. We tell little kids, put it in your nostril or your nose as far as your finger will fit, and then swirl it around for about 10 seconds. Again, using the little kid example, I tell them sing happy birthday to yourself. It takes 10 seconds. So swirl it around in one nostril, take the same swab, put it in the other nostril. We want sample from both sides, and we want it in there moving around for a good bit of time. We want a nice, gooey, juicy sample to be disgusting, but that's what we want. And we want it from both nostrils because we have seen cases where a virus will live in one and not the other. So we want sample from both sides. Once they've got that good gooey swab tip, take the cap off the tube, put the swab into the tube. I don't know if the tubes that you guys have used in the past have had liquid in them in the bottom or not. Have they?
Some did,
do, some don't.
Yeah.
Okay, so we've had the same experience. We used to have the liquid. It's a preservative. We do not any longer. It's a dry one now. It means that our collection kits don't expire. But the reason is that the reagents that we're using are extremely robust and sensitive. And so we've tested samples that have sat in a dry tube for a week or 10 days and have not seen a difference. We're still able to get results at the same sensitivity. So we're comfortable with not having the preservative in there, which is better for everybody. So take the cap off the tube, put the swab in there, break the stick at the notch in the tube or on the handle. I know you guys know what to do with that. Put the cap on the tube. And then the last thing is, I'm sure this is, again, stuff you've done before, but I'm going to make it a little bigger. Each tube will already have a label on it with 2 lines. I think the lines are black and not red like they are in this. We want the patient's first and last name and date of birth to be written on there. That's a CDC requirement that if some inspector or really anybody ever came into our lab and randomly pulled a sample, they want to be able to easily identify that it's yours and not mine. So our little QR code stickers don't do that. Handwriting their name and date of birth on this existing label does that. So do that. And then again, each kit, you have that strip of those little QR code labels that you're entering into the portal. Take that sticker off, put it somewhere else on the tube. We just ask that, of course, you don't put it on top of the handwritten label and don't put it on the cap. Put it somewhere else on the clear part of the label. There's plenty of room, and that's what we'll scan when we receive the sample in the lab. Once it's labeled, it goes into the biohazard bag and gets sealed. Make sure that people are sealing it. I mean, again, that causes that causes anxiety with our lab people, specifically our office people, when unsealed samples come in, because we have to treat every sample as if it's contaminated or as if it's positive, right? As if it's infected. And so when they receive samples in open bags and they're in the office and not wearing PPE, they get nervous. So we want to make sure that every sample is sealed in the bag. And then I'm sure you're familiar with those biohazard bags. If there happens to be any paperwork, if somebody doesn't have their insurance card on them, but they bring a photocopy of their insurance card, go ahead and fold that up and it goes in the pocket that's on the outside of the bag. Just don't put any paperwork or anything besides the sample itself inside the sealed portion of the bag. Make sense?
Yep.
Okay. I figured that would be pretty common stuff or stuff that you're used to. That's basically it. Are there any questions, things I didn't cover, things you need repeated?
Quick question on the labels. Is it okay if we print labels and stick it on there?
Absolutely. You mean the ones with their name and date of birth?
Yeah.
Yeah. 100. Yeah, absolutely. We do a lot with doctors' offices, and that's what they will do. If you can, that's wonderful. And if not, handwriting is fine too.
Okay, great. Thanks.
Yeah, that's awesome.
What is the age restriction of children?
There is not one. We do infants to as old as can be. Lots of pediatricians' offices use us. The swabs that we use, you'll notice, are the tips are very small so that they'll fit inside a baby's nose. But we have pediatricians that are doing it on newborns, and it's approved for that. It's not like a 2 and up like some reagents are. Let me mention a couple other things that I neglected to. On the portal here, when you are registering a new sample, we often get the question, how often can people be tested? There's no hard and fast rule for that. It really depends on medical necessity. But because the person that is ultimately determining the medical necessity is our lab director or medical director who lives in Pennsylvania, she's not going to be there on site to look at every patient herself. And so she's just going to rely on the information, of course, that you guys give her through the portal to determine that indeed we have a medical necessity for each test. So what we've done is we have put something in place where if you have sent let's say you collected a sample from a patient on Monday and the patient comes back on Wednesday and we haven't tested that sample yet. Or maybe that's probably a bad example. A good example would be you collected a sample on Monday and you forgot to ship it, and the patient comes back on Thursday, wants to get tested again, and you try to enter their order. If we have not rejected that sample yet, and it's still showing as pending, as if we're still waiting for it, you're going to get an error that says this patient cannot be tested again because we still have a pending order in the system. Now, if it's a case where you didn't send it for some reason and you want us to reject it, if you get that email message, you're going to contact us and say, hey, can you please reject that sample from Mary Smith from Monday? I'm testing her again today. The other thing that's in there is using a similar example. Mary comes in on Monday, comes back on Friday. We've only, we got the sample on Tuesday or maybe Wednesday, depending on when you guys shipped it. We get them the next morning, but sometimes if you ship it late at night, it might take, till the following day for it to go out. If a week has not passed between the first sample and the last, you're going to get the same message. Hey, it has been, it's been less than 7 days since this patient has been sampled. If there is a true medical necessity that you can tell us about, contact us. If not, she's got to wait until 7 days have passed.
Such as she tested positive.
Yeah, if she tested positive and she's back 4 or 5 days later to get another test, absolutely. Great reason. You'll contact us and we will override that and let you,
Okay.
or we may just tell you, just put the sample, just send us the sample and we will, we'll do that. I don't really know how we manage that. I think what we'll tell you is
I would think the majority are 7 days out then.
Yeah, definitely. And that's just that's just the safest course of action, just to make sure that we don't get into a situation where an insurance company accuses us of abusing things. Before May 11th, it was the wild, wild west, right? There was very little oversight going on. And you've seen what's happened to some of the labs that I think that maybe we're treating it as if it was the wild, wild west. They're not around anymore. Or they've gotten in trouble or whatever. We've never been like that. We're doing everything above board. And now we kind of feel like we're rising to the top a little bit because we're still around and still thriving in spite of the emergency order ending. Everything that we're doing, we've been inspected. We will be inspected multiple times, I'm sure, by Medicaid and Medicare and all of them. And we're cool with that because we try to put as many safeguards in place to make sure that we are in compliance with everything that we do. It's really, really important to us. And it protects you guys as well, of course. So that's about it. The last thing that I will mention is, speaking of our medical director, the one who is responsible ultimately for ordering and approving all of these tests that are run. A new requirement that has come up since the end of the emergency order is that she has to, what you're doing when you submit a sample is you are acting on what's called a standing order that she has that is basically empowering you to act on her behalf. At some point, and I don't know when this is, we will set up a session where she is going to, I have a feeling it will take 10 minutes. Where she is going to get on one of these and she is going to read that standing order to you, because that is a checkbox that's a box that she and we need to check, excuse me, for legal compliance specifically with Medicare and Medicaid. So we'll set that up down the road whenever it happens. But it's just something that, again, she has to do because, again, at the end of the day, it's her butt that's on the line for any, any shenanigans that go on. So she's required to make you aware of here's what she's empowering you to do with her standing order. That's probably something new. I don't know if you've done that before. We didn't have to do it until recently, but it'll come up at some point. So we'll let you know when that happens.
Okay.
All right.
Sounds good.
Any other questions right now with this?
Not for me. Everything looks real straightforward, and we'll get the recording and all that kind of good stuff. And
Yep.
yeah, I think we'll be fine.
Okay, so I sent that group of collection kits that you asked for, Frank. Let me stop the recording because I'm getting feedback.
Getting some.
Okay, let's see.